Welcome to the Therapist Thrival Guide. My name is Miranda Barker. I'm a licensed clinical social worker, and I'm here with Dr. Lucas Bellini, LMFT.
Hello.
I got LMFT in there really quickly, just so that I got it in there before you said hello. Today, we are talking to one of our amazing franchisees, Saroni. Do you want to go ahead and introduce yourself? Tell us a little bit about yourself.
Oh, sure. Thanks for having me, Miranda, Lucas. I'm Saroni Kandu. I am a franchise owner of Ellie Mental Health in Concord, Missouri. I own one location, working on more, working on expansion. I opened in April of this year, actually. So far it's been great. It's been a great journey. Amazing journey, actually.
We're so happy to have you on here. I had a realization right before we started recording that you are the first franchisee that we've actually had on the podcast.
Okay, that's amazing.
So I'm so glad you're here, and I'm so glad that you can be on the podcast, because I think that our franchisees offer such a valuable insight, valuable part of Ellie. I don't know how to say that. That was very clunky.
Well, it brings a different perspective. You know, it's like our franchise owners are people who are not necessarily clinicians or didn't dedicate their careers to mental health, but because of personal reasons, you know, there's something meaningful about mental health. Some aspect of mental health has touched their lives in a significant way. And so they were passionate about using their business success and expertise to bring mental health into their communities.
Absolutely. So we wanted to have you on here to talk a little bit more and continue our conversation about suicide prevention awareness, because September is Suicide Prevention Awareness Month. And the timing just worked out perfectly. You had reached out to me and you said, I need to talk to you about my story. I want to talk to you about why I became a franchisee, because it's so timely and so vital to this month. And so I was hoping that we could have you on here. You could share a little bit about your story and what motivated you to open an Ellie Mental Health in your community, and just kind of have a conversation about suicide and the stigma that surrounds it, and how important finding preventative care and family support is for families that are walking through suicide loss, as well as people who are struggling with suicide or suicidal thoughts. So do you want to go ahead and kind of share a little bit about your own story and what brought you to open an Ellie?
So it's such an interesting journey for me. Last year, we had a lot of life experiences that brought mental health very, very close to our lives, both with my sister and my kids, and even some extended family. So we were knee deep into understanding mental health and finding help for our children who were showing signs of mental health issues. And so this is like, post-pandemic, right? So kind of hit us really, really hard. And so while we were doing that, going through all the research and reading and finding out what the different mental illnesses are and how do we help our loved ones, finding therapists, going for psychiatrist appointments and just going through the system here. This opportunity with Ellie Mental Health franchising came into my path. And so my husband and I, we sort of looked at each other and said, this is a sign, like we have to do this. We have to do something to help change the system, to help, give access to mental health to everyone, not just those who can afford it out of pocket. My husband and I are, I guess you could say, lucky that we could afford it out of pocket. All the therapists we went to for our kids, they didn't take insurance, right? So, just learning about Ellie and what it's about and what Ellie is doing to change the mental health space, and for us to have such a personal, interest and investment in it because of our family, we decided we had to do this. It wasn't really a choice. It was like, we have to do it. So that's why we decided to invest in opening our own Ellie franchise. And honestly, I couldn't have found a better company to do it with, because Ellie Mental Health just reflected everything, like all the core values reflected everything that I represented and that I wanted to bring forward to my community. So the rest is history, as they say.
Yeah. So it sounds like your family was walking through kind of their own mental health struggles, and you were finding it really difficult to find accessible therapists in your community that took insurance. This is actually like a story that I hear from a lot of franchisees, just the frustration of trying to find care and trying to realizing that there's such a need in their communities, and then feeling like they wanted to bring it there to fill that need.
And what I appreciate about what you shared was, it's like you found your family therapist, you got your family care, but you knew how difficult it was and how much of it was a product of your financial situation, which you knew did not generalize across other families in your community. Mm-hmm. And so your concern was more so for them. You knew what it was like to be able to have access to that. You knew that other people didn't. And so you wanted to do something to eliminate a lot of those barriers that other families would have likely faced.
That is exactly right. Yeah. And the other thing was that my sister had, just to share something very, very personal, is she, right at the time we had signed and ready to, go forward with this journey, she knew about it. She knew what we were doing, and she was excited for us. The year before, she had attempted suicide. So she really, and she survived, which is a huge, I don't know how to say it, but it was a blessing, because we learned so much from her survival, from everything that she was able to learn from her diagnosis. So one of the things that brought us to the purpose of opening our own clinic was not just the accessibility, but access to mental health care, but the early intervention. So we wanted to, and one of our goals is to get into the school system and really bring mental health to kids, because I have experienced it firsthand, where my sister didn't get the help she should have gotten when she was a teenager. And so fast forward, at the age of 38, she really did suffer a lot. The pandemic made it worse. And, when she did get diagnosed correctly, it was already late. She was already in the hospital, seeing a psychiatrist. So what Ellie was about is, the bottom tier, right? Get them help when they were at the bottom of that pyramid, not at the top. So that was really a driver for me, and then seeing my kids who within a year showed so much improvement in their coping mechanism of their mental health. That just spoke volumes to how, yes, I have experienced it firsthand, when you do get help early and when you don't. So I had the stark difference in my own life.
And so you're seeing changes, you're seeing things look different, and you're experiencing the impact of early intervention, which is more so of what you experienced in your children's generation of the family. Um, when well, maybe I'll just, where would you say you're at with your sister and your grief and your loss? And because we spoke about this about a year ago, I remember, when it was more, I mean, much more raw. Where would you say you're at now?
Yes, we did. It was very, very raw at the time. She uh, she died by suicide December of last year, and um, I feel like if it wasn't for Ellie, I'm not sure how I would have channeled the pain and the grief. Um, 3 months, aftermath. That's all that kept me going was Ellie, and also to see that my parents make sure that they could recover and go back to their life uh, as normal as, or I guess the new normal. That was my goal. But yeah, Ellie was what kept me going, and I'm saying that with the utmost sincerity, and like there's nothing truer than that, because I was able to channel all of that on, this is what I have to do, this is in honor of my sister and in her memory, especially because she was never quiet about mental illness, mental health services, health care, mental health care, and also med management, all of those things. She firsthand would talk about it with anybody who would listen. So the Ellie is what really helped me to sort of process that. I did of course have my own therapist that I was going to, so that definitely helped, and then of course family helped as well. But I'm at a place now where yes, I do grieve, but I feel like um, Ellie Mental Health, this is really going to be my mission and my purpose, and I feel like my sister is sort of working through me, through all the challenges of the journey, and it's been truly amazing. Like, I don't know if whoever listens believes in that, but I feel like she's working with me through the universe, the way that everything is working out.
Could you share a little bit more about kind of her story and the timeline of you opening the Ellie while kind of navigating this massive loss?
Yeah, it was so interesting. She knew that we were opening an Ellie. The only thing she said to me was, "Be careful, it's a lot of money." That's what she said. But, of course, that was her practical side kicking in. She was going through the therapy that she needed. She lived in Canada, so the system is a little different there. Um, Good or bad, I don't know, but she got therapy wherever she could, because the one therapy that she did need was dialectical behavioral therapy, and those waiting lists were really, really long. So she, honestly, I will tell you, she tried everything that she possibly could. She was not liking the medication, because after you come out of the hospital, they give you some very, very strong meds. So she was really struggling with that, weaning off and taking new meds, and a lot of loopholes in the system, health system with medication, and even the right therapy. Like, even if she had a social worker, she had a therapist that she was going to, and she had a psychiatrist. They were not really talking to each other, coordinating any of this. She had to coordinate all of it, being the patient herself, which that still blows my mind today how that works. But she tried. She was doing her best. She even did holistic uh, borderline personality disorder holistic therapy and all those things. So she, just knowing that she was trying everything that she possibly could, just knowing that, as we were going through the whole journey of our opening our Ellie, it just sort of, and then she was there every step of the way on my son's mental health issues. And then when my daughter was starting to show signs, she was there every step of the way. She was there. She was sending us information. She was, so not while she was working on her own mental health, she was also helping us, and so yeah, she was an amazing human being. But I guess she just couldn't continue living in that pain. That was the thing. But she was there to see that how her nephew got so much better, like 180-degree turn in getting the help that he needed. So she did witness that, which is a blessing.
I mean, it's just thinking about what she went through to get care, and thinking about, even just being diagnosed, finding a diagnosis that made sense to her at so late in life too. I mean, that just, it makes it harder to really navigate the system, or really kind of build some of those skills. But I guess one of the things that I'm curious about is, when she was going through these different treatments, or when she was hospitalized, how much did you know about that at the time? How involved was your family? Because you talk about how, like, with your son, there was a lot of family support, and I'm wondering, like, how much she involved you guys in that.
Yeah, that's a really good question. Before she attempted suicide, she really didn't talk about her, all the pain she was going through. She didn't talk about it much. We knew that she had some level of depression, so she was going to therapy and she was taking depression meds, and that's all we knew. There was no talk about suicidal thoughts or anything like that, and so when I got to know from my son's school counselor that he had checked quite a few boxes and suicidal thoughts was one of them, I didn't even know what to think. I had no idea. I was like, first thing was like, I must be the worst parent alive. That's how parents think, because they don't know and they don't have the knowledge. And so this was pre-pandemic. And so, my sister really didn't share how she was really feeling. And she told me later, like after she survived her first attempt, was that she didn't, because she didn't think we would understand. And which is true, because we wouldn't have understood at that time. But had she maybe thought about educating us, but at that time, she didn't think it was going to be like life-threatening, right? Her suicidal thoughts. It was only during the pandemic, during the isolation, that she got to that level of suicidal ideation, So it was kind of like, when my son, I got to hear that, and then he went through the lockdown and all of that, and he seemed fine. But then, when we were starting to open up after the pandemic, we could really see that he was not fine. And that was about a month before I got the phone call that my sister's in the hospital because she attempted suicide. So literally, it was like, the timeline was just, yeah. So it just all happened at the same time. And then it's like, your universe just forcing you to, like, you better know what this is, what's going on. And then that's when we learned so much about suicidal thoughts and all of that, and how my sister, honestly, if she had gotten her diagnosis of borderline personality disorder, even in her early 20s, it would be a very different story now, I think. But she was 38 when she got diagnosed, right? And so that's hard. And BPD is one of the most psychologically painful mental illnesses. And so it was really hard. And she knew that. She knew that she would never really be all the way, I guess, cured, if you will. But she kind of knew that. She told me that. Um, so yeah, that was kind of the time.
Providers were communicating to her that it wasn't curable, that she'd be forever, kind of stuck in this place of at least having components of pain from the borderline personality disorder. Was that communicated to her by professionals, or is that a conclusion that she came to?
No, it was. So when she was in the hospital on an attempted suicide, they assigned a psychiatrist. And so that was the time when the psychiatrist called me as the closest family member. And we had a conversation where he asked me to describe my sister since I'm closest to her. And he sort of matched up the symptoms. I was just I didn't know anything about it. I was just talking about what I've observed about my sister through the many years of her adulthood. And so he just matched it up and he said, this is what she has. She does have major depressive disorder, but she also has borderline personality disorder. And he went through the symptoms and it was just like all these dots connecting in my head because there were so many things I couldn't really have answers to as we were growing. I mean, as adults, there were things that happened, between us, between our families, and that I just couldn't, I couldn't make sense of it until that diagnosis happened and everything sort of connected, all the dots connected, and it all made sense. Mm-hmm. So that's why I said it was kind of a blessing that she got it, but it was also too late when she got the right diagnosis.
When she got that diagnosis, was it, I think for a lot of people, when they receive a diagnosis, especially if they've been struggling for a long time, it can be helpful to finally have like a name or it can help normalize some of the symptoms or things that they're going through. But for others, it can feel like you're trapped and you're never going to get out of it. Do you have a sense for if receiving that diagnosis was helpful for your sister at the time, or if it provided some way of like normalizing what she had been going through?
Yeah, I that's a really good question. I don't know if it was good for her or bad for her, but what I've heard from just, her and then from other friends that I talked to later on, she did have a sense of relief to know what it was that, made her feel all these different emotions. Because as a patient of BPD, it's a lot of emotions, right? And she wasn't sure how to think about that, how to think about some of her closest relationships sort of failing, not being, and you always feel that sense of failure until she got this diagnosis, and then she was like, okay, this is a relief.
It's not
but
just
I think
me.
and then after that, though, I think she did go through that realization that I don't know if I can ever get better. Like, it's so hard. It's so hard to change my thinking because this is how I've been thinking for the last 25 years of my adult life. I heard that. I listened to her and I said, I understand, and I don't know what to say. Like, honestly, like, what do you say? It's like a cancer patient that says, I tried everything and I only got diagnosed with this tumor now when I had this tumor for so many years. Like, what do you say? It's the hard truth that she was diagnosed very late in her life, and that's why my husband and I are all about early intervention. See the signs, understand, seek help, because you can save lives.
When we did the last episode we did on this topic, one of the things we talked about was the role that meaning plays in the grief process, and acknowledging that it's a tricky one, but seeing that you're kind of deeper into your process of grief, and that Ellie was already, something that was part of your life, investing in that meaning seems to have been a terribly useful resource for you to put that energy in as you continue to process your grief. And so beyond meaning, what are some, what are some things you haven't mentioned yet that you would say this experience has taught you that you would like to share with people and that you want other people to know?
As someone who is not the one who's suffering, someone who is seeing it from the outside and seeing my loved ones suffer, for those that are like me, I feel like the message I have is do whatever you can to help your loved one to get the help they need. Easier said than done. I totally understand that. I had a tough time with my teenager. He didn't want to take medication, so it was a challenge to get him to a psychiatrist, but he did finally agree. That's the biggest thing that I learned is mental health is something that needs to be diagnosed and treated. It's like any physiological health issue, and it's something that's the whole reason, stopping the stigma and just breaking away from that. Recently I met an acquaintance in our community who lost her husband to suicide, and it was more situational depression. And she was telling me how he was starkly just against any type of counseling, therapy, psychiatry. And this is because in our communities, in our culture, there's so much stigma around it, and that's why he didn't want to. Ultimately, he died by suicide. But that's our number one goal, our mission, right? The message is, yes, absolutely break the stigma and talk about it. If someone can talk about cancer, or how they survived cancer, how their loved one survived cancer, then you can definitely talk about how your loved one survived mental health issues. And I tell my son this all the time. He has this, he's 17, and he has this moments where he's like, I feel like I haven't accomplished anything, and I just put the mirror in front of him and I said, let me tell you that you survived depression. That's like saying, someone who recovered from cancer saying, oh, I feel like I wasted my life, I haven't done anything. No, you are recovering from an illness. And that's the same lens that you should be looking at it through, right? Even if it's mental health, it's still an illness that you have to treat and recover from, and look at what you've done. Look at how you've changed your life around. So that's my message to people is truly talk about it and break the stigma, and get the people that you love and the help that you can.
Yeah, and take it seriously, or take it as seriously as we take physical health conditions. Mm-hmm. If I had a broken arm, I wouldn't wait 2 weeks to go to the doctor. Mm-hmm. Yeah. And the degree of urgency is just as relevant.
Well, but on that note too, like oftentimes you don't have to wait 2 weeks or 7 weeks or 10 weeks to go see a doctor if you have a broken bone. And so I think that is where part of what I love about this franchise model is bringing more providers, bringing more mental health care to communities that don't have mental health care, so that people don't have to wait so long to find care. Because I think that, it was either NAMI or another mental health organization that was talking about how the average wait time for people to find a therapist or get care is at least 7 weeks. It's like, it was something, and that was virtual, in person, all of it. And I think that we see that number that is astronomically higher in most communities even. I mean...
Yeah, it's an average.
Exactly. Like, it's, for some people, they'll wait on wait lists for months and months and months before they can see a therapist. And so I think that, kind of going back to your point even before too, where increasing clinics, finding more ways to become more accessible for people so they don't just have to find cash pay private practice therapists, and they can find people that take their insurance, or they can find people that have a lower wait list, things like that is absolutely crucial to this conversation, and making sure that people can find the help that they need and not just suffer in silence or suffer feeling like they're never going to be seen by a psychiatrist or a therapist. So I think the accessibility issues that we're seeing in this country, I mean, as well as in other countries too, is a big part of this issue.
We don't have mental health urgent care. We have emergency rooms, but to get a bed in an emergency room for mental health related reasons is a pretty high threshold. Mm-hmm. And so there is a pretty big demographic that's getting missed, where there is a sense of urgency, but the resources just aren't necessarily there. But in any case, there's still a difference between, being stuck in that place of pain and having no sense of what's next for you and what's an option, and being in that same place, but knowing, I have an appointment in 7 weeks and 12 weeks, and so even with that urgency, it doesn't always necessarily mean getting them in front of a professional within 24 hours. But it does mean getting them an appointment with a professional scheduled maybe within 48 hours. Mm-hmm. So at least there's that sense of there's something ahead, something I can hold on for, which can be critical.
Well, and it can help you feel like you're not in this hopeless state. Like this is, you've got something coming that will be helpful. Yeah. Mm-hmm. You spoke earlier just about, and I know that we're running out of time, but I just wanted to say too, how the loss of your sister and this journey that you've been on these last few years has made you such a fierce advocate for your family and for your community and for people that need mental health care. And I really appreciate that about you, Saroni. And I think that's so admirable. And you spoke even earlier too about how you feel like your sister is kind of like walking through this with you, and she's like watching over you in a way. And I think I believe that too. I think that's so evident, and it absolutely has affected kind of how you go about franchising, how you go about leading a team of therapists and growing your business. And I really applaud that. And I think that I think your sister's watching out for you too. I love it.
Yes, I think she is for sure.
What was your sister's name?
Shotomi Kandu.
Shotomi,
yeah. Yeah, she was an amazing human being. Yeah. Yes.
Yeah, and I can sense that just through your spirit and how you talk about her and keep her alive in the work you continue to do.
Yeah, I mean, I just, just to give you an idea, the celebration of life I had in Vancouver, 40 people showed up. The 40th birthday that the Bengali community, because we speak, our native language is Bengali. the Bengali community held in Vancouver was 50 people. So, and then each, her workplace had a memorial, and so it's just seeing the kind of impact she had on people's lives, from children to adults to elderly. It was amazing. And she was an amazing human being.
As are you.
Thank you. Thanks, Lucas. Thank you, Miranda.
Yeah, thank you so much for joining. Any other kind of last thoughts or things that we want to kind of end with?
I appreciate hearing from the perspective of a non-clinician, somebody who doesn't live their professional lives in this industry, but nonetheless, understands the critical role it plays, just in society and communities at large. And that, therapists can't do this alone, and what I love about this franchise model, and it's something I hope it continues to awaken and we see spread about in different circles, outside of Ellie, is, more folks like you who aren't clinicians or direct care providers, but you see the need and you do become that advocate. You do become the person who plays the part in generating those resources, generating the awareness, and that's going to play a big part in where we're all trying to get.
Mm-hmm. Yeah. Thank you so much for joining, and thank you guys for listening, and we'll see you next week.
Thank you. Thanks, everyone.